Going to discuss about epidemiological problem about HIV. So, a pregnant woman was diagnosed with HIV infection. List the measures you will undertake to prevent the transmission of HIV infection to the children. So, guys, tell me what measures do you want to take? So, do you allow her for normal delivery? Do you suggest her breastfeeding after birth or not? Do you suggest her to take antiretroviral therapy even though the T cell count is greater than 350 cells? What do you think? Do you allow continuation of ART to the infant also? If so, up to how much age? So, about these, you will find answers. Okay. Excuse me. Okay, let's start for today. So, if a woman is pregnant and she is diagnosed with HIV, so HIV can transmit through vertical transmission, means from infected mothers to the baby, it can spread. And when it will spread appropriately during normal delivery, due to the rupture of the membranes, there is a mixing of the blood of infant and the mother. Then there is a chance of uh, transmission to the baby, newborn baby, through the blood transmission. Okay, which is known as vertical transmission. Even through placenta, it may get transfer. So what you will suggest is probably to undergo elective C-section, but every time you can't do that because in poor rural areas there are less chances of a mother to get LSCS there. Probably more commonly there will be normal deliveries there. So first you will advise for C-section. Second, about the cell count. If the cell count is less than T cell count, normal cell count not, the HIV mainly targets the T cells. Okay, it will have CCXR5 receptors and it also has CR4 receptors, mainly targets CD4 cells and cause immunosuppression. So, making the individual susceptible to various opportunistic infections and like especially TB. Okay, so if the T cell count is less than 350 cells per mm cube, then for the mother's sake, for the survival of the mother, you will advise her to take ART, okay, antiretroviral therapy. And if the T cell count is greater than 350 cells per mm cube, then also you will advise the mother to take ART for the sake of the baby. Okay, and you will suggest the ART for infant also, means for the baby also up to certain time, up to 6 months of the, up to first 6 months or up to 1 year depending upon the situation of the baby T cell count. Okay, so and you probably for surely will advise breastfeeding because it contains many antibodies, it is very rich and provides natural immunity to the baby, so which provides passive immunity, so it contains lot of benefits. So you suggest breastfeeding up to 6 months and you advise the mother to start complementary feeding, and you again say the mother to continue the breastfeeding for more 12 months also, because as the baby is more prone to more infections, you will suggest her for breastfeed for more 12 months. Okay, means up to 1.5 year she should be breastfeeding. Breastfeeding is not contrary at all, because the breast milk, she won't excrete the virus through the breast milk. Okay, there are more advantages than disadvantages through breast milk in HIV cases. So then which drugs you will advise? Efavirenz you should not advise in first trimester. So you should be giving nevirapine in the first trimester, and in second trimester you will be giving efavirenz and nevirapine together. Okay, and for baby, as I said, up to 6 months you will give ART, or it may extend up to 12 months. Okay, and constant visits should be done for CD4 count, how much it is going on, like that you should think. Okay, tenofovir, namivudine and efavirenz you should give the ART, and efavirenz should not be given in the first trimester. Nevirapine should be given. Okay, these all should be done for the pregnant women. In case of pregnant women, for preventing the mother to child transmission, you will advise her to take ART even though the cells are greater than 350 cells per cubic mm, for the sake of the baby. And you promote breastfeeding, and you avoid efavirenz, and alternatively nevirapine you will give in first trimester, and you will advise selective C-section. These things you should be knowing and you should be doing for the sake of the healthy baby. Okay, that's it guys for today. I told. That's it guys. Thank you.